and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and today I get to interview my nurse friend, Melissa Mills. Thank you so much for the honor of your presence today, Melissa.
Yeah, thank you. I'm excited to be here and to talk to you. So thanks for inviting me.
Yeah. So you are already an established leader in the nursing community, I would say. I don't know if you would say that, so I needed to lead by bragging on you. If you have not followed her yet on LinkedIn, you should, because she is always writing something incredibly insightful. So Melissa, would you like to share with us your nursing journey and how you got into nursing?
Yeah, so I have been a nurse for 26 years. It makes me feel really old every time I say that, but 26 years. Initially got my ADN. I worked as a CNA while I was in nursing school and then received my ADN and worked bedside for a while in pediatric. So I was in the neonatal intensive care unit and the pediatric intensive care unit. And then after that, I went into home care and hospice. And that's really where I spent the bulk of my, clinical, as well as that's where I started to learn leadership, is in hospice and home care settings. And I loved, especially hospice, really, really enjoyed working hospice. But then I really got into leadership and went back and got my bachelor's degree and just wanted a higher view, like a broader view of the healthcare industry as a whole. And so went back and got my master's in healthcare administration. And I was working at a job that I actually despised when I graduated with my MHA. And so then I've always loved writing. Like that was like, I was the nerdy little kid with a notebook and a pen, always writing poetry and writing different things. And so I always wanted, that was my first choice, was to be a journalist. It wasn't to be a nurse. And my parents told me that I would probably be poor. So I needed to get something that I could actually make money and make a living at. And so, I was like, you know what? I really want to figure out if I can make this writing thing work alongside of my nursing background. And so I started doing freelance writing and then ultimately found curriculum writing, which is really where what I have fallen in love with and what I've been doing for about the last 7 years. Love curriculum writing.
Yeah. So I wanted you to talk more about your curriculum that you are writing, because it's so exciting and innovative the way you're approaching it. Before we move on from that, I just wanted to hit back on, you said you were learning leadership in hospice. Were you saying that you got a position that identified you as a leader, or were you saying that you saw things you wanted to change and so you were trying to take more of a leadership role? What was that like?
So a little bit of both. Within hospice and home care, that's really where I started advancing and getting roles that, up to director of nursing type roles in hospice and home care. But I think that's also where I really started to understand how to work on a team, how to be a good team member, because especially with hospice, you are dealing with people who and families who are under stress the entire time, right? And they're in their home. And so you really have to learn how to communicate. And so that was when I really started to learn how to become a leader, and then ultimately started going into roles that gave me the ability to use those skills.
Yeah. Okay. Well, yeah, that's helpful. And then when you transitioned into writing curriculum, tell us about how you're doing that right now.
Yeah. So I've worked for 2 different ed tech companies. So definitely in the startup world, which I love because no 2 days are the same. You're really being innovative and creative and trying to operationalize something new, which I really enjoy. I am the head of content currently for cinematic health education. And we are a company that uses, in our curriculum, we use storylines. So like full movie type, cinematography. So very high, level, content to show someone who is wanting to be either a CNA, a home health aide, or a homemaker, what to expect on the job.
So this is not your average LMS video education.
No, it is not. It's very high level. I mean, it was produced by the same man that produced The Blacklist.
Oh, the show, The Blacklist?
Yeah.
With James Spader and stuff?
Yeah.
What?
Yeah, so that's who directed it.
So we have to be a CNA for a minute.
Yeah. So we actually have two movies. One is called The Residents, and the other one is called Called to Care. So the one that is The Residents, obviously that is for our CNA training. And so it takes you along this journey with a new CNA who just graduated, and how she goes and starts to see the residents, how she, works with someone who has dementia, and she has to learn how to de-escalate a situation. She works with a younger person who is right around her age, but yet they were in a car accident and have, very acute injuries, and she has to navigate through how to work with that person. It's a way to help. We know that turnover is a problem in these entry level positions, right? Like I think it's like 67% of all CNAs turn over within the first 3 months after graduating.
Yeah.
Yeah.
And well, so, you're shocked, right? Like they've never been in this position, had no idea, because you don't make movies usually about what it's really going to be like.
Right. And so this gives them a glimpse into, what it might be like to work with someone with dementia, what it might be like to, the first time that you have to go in and you have to clean someone up who has been incontinent of stool or incontinent of urine. Like we've all been there, right? You go in and you're like, oh, can I handle this? Is the smell going to be something that I can or can't handle? And you actually get to see how she navigates through those situations. You also see her deal with, balancing her personal life and her professional life. So you really get to see that. And that's kind of like our anchor content. And then they also get the required CNA content, that is federally and state required. So they get all of the skills, hands-on training as well, but they get this really interesting way of seeing what it's going to be like to be a CNA or a home health aide.
Yeah. And I love that, one of them's Called to Care, right?
Yeah.
Because there's only so much, like, as much as everyone needs to be compensated fairly, there's like only so much you can pay people before, like, there's a certain level that they're like, there's no way you could pay me enough to do this. Right. And so if you just kind of like set accurate expectations from the beginning, like this is what you are signing up for, then they're not going to be shocked when they first get
Exactly. And, I think it's okay too. Like if you start seeing this movie as a student and you think, "Ooh, this is not for me," like that's okay. Right. Because we want people who are going to stay, who are going to, work as a CNA or home health aide for a while. Some will go back and continue their education to become nurses, but the turnover is a problem. And so really getting that really accurate view of how hard those jobs are, because I can tell you, I was a CNA. It was way harder than being a nurse, physically, for sure.
Physically, yeah.
Mentally, two totally different things, right? Because as an RN, you've got a lot more cognitive, decisions and things that you have to work through.
And responsibility.
Yes.
That was one thing. I was like so used to going into patient rooms as an aide. And so that part wasn't scary for me, right? I was in nursing school, and like some of the other classmates who hadn't been in a hospital were scared to even go in the room. And I was cool with that. But once I was the nurse, I couldn't say, oh, I'll just go get the nurse. Let me check on
Right. Exactly. You're
like,
oh shoot, I am the nurse. That's funny. I had that exact same experience, because you're right. It's a whole new role that you're still learning and trying to figure out how to navigate through.
Yeah. Well, I think this leads us on to talking about one of your passion projects lately too, that you've been writing a lot about. You want to tell us about that?
Yeah, so I am the fractional executive director for the Commission for Nurse Reimbursement. And so what the commission is working on, and many people don't, even some nurses don't realize that nursing services in the hospital, in long-term care, even in ambulatory, it's not a billable service. So physicians bill, nurse practitioners bill, physical therapists, occupational therapists, social workers, all of that is billable service. But the way that nursing care is paid for is in the room rate. So we are rolled into the room rate. And this happened all the way back in the late 1920s, 1930s, when the hospital was trying to figure out how to pay for nursing services. And they really didn't want nurses, who were mostly women, to have that connection to the money. And so they looked into the hotel industry and saw that maids and housekeeping was rolled into the room rate. And that is how they put nursing into the room rate. Fast forward, what that means to us today is that if a hospital says, okay, we need to increase our revenue and we need to make some cuts, we're going to make a cut with nursing, they get rid of nurses. They increase our number of patients that we care for each day. Of course, that means that patient care is less safe, right? Mm-hmm. And it impacts outcomes, but that allows the hospital to recoup some of that money. So they're not getting, like, if you provide more nursing care, the hospital is not getting more dollars in reimbursement. Yeah. And so what the commission is doing is we are really early. We were started in early 2023. We're very early in the game, but we are doing a lot of awareness and trying to get policymakers, legislators, CMS, CMMI to understand what this problem is, to see if we could somehow impact and change that reimbursement structure to help with the, sustainability of the nursing profession.
So are you looking at actionable steps right now? Like, what is an example of an actionable step towards changing that? Or are you just kind of brainstorming solutions still? Or what point are you at right now?
So a couple of the actionable steps, we do have, two nurse economists that are on the board of the commission, and another person who does a lot of policy work. And they have created several, I think maybe like 6 different models of new ways that we could capture what nurses do to be able to bill for those services. So as we continue
capture them in Epic or whatever the EHR is.
Okay. Yeah. And so as we, start to share these models with policymakers, legislators, other stakeholders, then we can start, there's going to be iterations on these models, right? Like none of them are probably going to be the model that, if we get this changed. But as we start to iterate, then we can see where, how we could operationalize a model to be able to start to bill for the care that nurses do.
Yeah. And actually like quantify it, hopefully.
Yes.
And at least make it more recognizable. It's like, look, this room is sitting here and you've got this rate, but if there's not a nurse in there to provide that care, what are you really billing for? Exactly.
Right.
Yeah, that's interesting.
Yeah. And if you think about it, I mean, I think sometimes even as nurses, we have a hard time coming up with what we do, right? Like we
so
care
much
for people, but it's so much that you can't possibly, write down every single thing that you've done in a 8-hour shift or a 12-hour shift. It's very, very hard. What we do is very hidden.
Well, and we also would need to start I think you can write this down for your, commission and your model as you're building. Make sure we're billing for things like social workers would if they're providing psychosocial support, because we are, or if we're providing an education about when they go home. And I mean, of course, we've got our little education tabs and everything, but there's so much like emotional support that nurses are responsible for and expected to provide. Like the doctor comes in, drops the bomb, walks away, and 100% trust that the nurse is going to have to deal with the emotional ramifications. And that is an expected part of our workflow.
Yeah.
So
for sure.
Like we could even like schedule this. It's like, well, how about we do this at this time so we have plenty of time to emotionally process with them? And maybe not every nurse does that, but it is not uncommon.
Yeah. Yeah. And it's just, we do so much, nurses do so much that it's very hard even for us to come up with that like list of all the things that we do.
Mm-hmm. So true. So, we would love to solve all of the world's problems, but we have limited resources, and we want to be strategic in how we use those resources. So I'm going to pose a $1 billion question to you, Melissa.
All right.
And so if I were to give you a grant for $1 billion, and this number didn't come out of thin air, like apparently it's common in an interview to ask a question of, if money was no object, what would you want to do? But I'm specifically asking about $1 billion because the American Nurses Foundation did research into philanthropy money directed at healthcare and showed that only 1 penny of every dollar given towards healthcare was allocated towards nursing specifically. And if we doubled that and got an additional $1 billion, that would be great. But we would need to be strategic in how that was used, not just like build a couple of wings on some nursing schools and call it a day, because that's not sustainable, duplicatable change. So you're an educator and you're a leader and you like to think about the big picture. So if you were given a $1 billion grant to be allocated to fix healthcare in the ways that you see it could benefit from, how would you like to see that $1 billion used strategically?
So I would definitely use it in education. And I think, when you look at nursing care, a lot of times you think RN. But there are other types of nurses, right? Even CNAs are in that nursing kind of trajectory or group. And so I think I would start with introducing specific types of education in different programs. I think even leadership education is the first thing that comes to mind. And even CNAs need to know how to be a leader, right? Like we all need to know how to be a leader, how to lead people to the, better choices, better decisions. You're working with other staff, whether they are reporting to you or you're just working alongside them. And so I think having leadership education embedded into every nursing program, and then specific to CNAs, I think we don't give them enough education, enough time. Most CNAs become a CNA in 6 weeks.
Yeah.
And if you think about that, they are the ones who are likely keeping skin healthy so that we don't have breakdown. They are the ones that are stopping and preventing falls and educating on how to transfer correctly. And so really investing that money back into their education so that we can train CNAs and then keep CNAs at the bedside, because they are so important and we really don't have enough of them right now.
Right. Could you give some examples of leadership training that you would want to make sure got into those programs? Like, does everyone need to have a John Maxwell book that they go through, or what specifically would you recommend? Like, as far as
I think we go past the Who Moved My Cheese type of books, right? Like, I think it has to be like really practical leadership training, and it's not about holding a leadership role, right? I think it's not about having a title that says I'm the manager of this unit, I'm the director of this. It is more about being a leader in the ways of how to work with people effectively, how to de-escalate situations, how to communicate with people who communicate differently than you do. Because, when I look at the things in my career that really helped me to kind of increase that trajectory and get to the next level, whatever that was, and likely was a different role, but it really goes back to my abilities and me leaning into being able to work with people that I wouldn't necessarily always wanted to work with, right?
Yeah.
But you have to learn how to work with them. And that is leadership. That is learning how to work with people and to be a leader.
You have to lead the interactions into a peaceful, productive path.
Yes, absolutely. Absolutely. Because we've all worked with people that we didn't mesh with well, right? And that is, problem solving and, de-escalating confrontations. Like, that is all leadership skills. And every nurse needs that, because so many times nurses get into situations where they just don't know how to navigate those situations, like really tense situations, because they've never been trained how to do that.
Yeah. Well, I think that would be beautiful. And it definitely goes along with what I've been surrounded by at the Kentucky Nurses Association, where we're talking about how every nurse is a leader and identifying as a leader so that we can embody that, right? And lead our communities to be healthier. So I think you're hitting the nail on the head with that. So
and I
maybe
think
you can write some curriculum that can somebody can make $1 billion donation to put your leadership movie in every nursing program.
There you go.
Why not?
There you go. Because I think, even if you look at, long-term care is struggling right now, right? And so many long-term care facilities don't have, like, the majority of their nurses are LPNs. And I think if you asked a lot of LPNs, are you a leader? They would tell you no. They are. They absolutely are, because they are leading that unit. They are, working with the CNAs, working with families, working with residents. They have to have those leadership skills. So it's not just about, the roles, but like you said, it's us embracing as kind of a unified voice of nurses that we need to have leadership training.
Instead of saying, well, that's not my job because I'm not the director.
Right.
But also being empowered in the culture of us recognizing one another as leaders, right? And leading together, leading the community together to better outcomes and better health. So I definitely love this vision. So maybe we can see something come of that.
Absolutely. Let's do it.
Well, I really appreciate you taking the time in a busy day and a busy week to sit down and share your vision with us, Melissa. And so
thank you.
If people want to learn more about what you're doing, you can find Melissa Mills at LinkedIn. And then do you have any other websites or social media channels you'd like to?
Not right now. I have a couple things that I'm working on, but right now, just LinkedIn.
Okay. That's awesome. She has great content there, you guys, and it covers a whole bunch of stuff. So just follow there. All right. And again, this is the Nurse Rosa's Insights podcast. You can follow me on social media at Nurse Rosa Speaks and subscribe to this podcast to hear from more incredible health stakeholders and their great ideas. I'll see you in the next episode.